Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello, and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I want to talk about the difference between hypertonicity and muscle shortening. Because on palpation, they feel the same. But the distinction becomes important or relevant when we talk about how we treat a tight muscle. Because if you're treating a muscle that is tight because it's hypertonic, you may use the motor point of that muscle and actually correct the muscle shortening, but find that the muscle remains hypertonic. So let's talk about it. I was in a Facebook group yesterday, and somebody had asked about motor point for the Psoas, and how they release the Psoas and what do people recommend. And of course, everybody has their go-to favorite way to treat a Psoas issue. And many of them were advising against treating the Psoas directly because, in their opinion, it is a secondary to something else. Someone was a big fan of fascia pecking on the rectus abdominals, sort of in that McBurney spot where you would test for appendicitis, pecking on the fascia for 2-3 minutes to release the Psoas. And there are people who like to dig in and massage the Psoas in the abdominal area. And all of those can be effective. I recommend the motor point of the psoas that is in the femoral triangle below the inguinal ligament, 2 fingers lateral to the femoral pulse, 1 finger inferior to the inguinal ligament, and you land right next to the sartorius, the inner border of the sartorius. I'm not going to go into that point location any further, but that's where I treat the psoas for a dysfunction of the psoas, which can lead to back pain, knee pain, sciatica, headaches, neck pain, a myriad of things. Okay, so the psoas, in my opinion, is a huge part of many, many issues, and Yonda said, most issues start at the pelvis. I believe the psoas is number one in that pelvic dysfunction leading to things like the lower cross syndrome. And I've talked a lot about those things. I'm not going to go into it, but I wanted to distinguish between fascia pecking for the psoas and motor point treatment of the psoas. And then I realized in order to even make my case, I need to backtrack, and we need to talk about the muscle tone. So, because I don't think it really gets talked about a lot, we kind of assume that we all know what muscle tone is. And I'll admit, if I had to tell you without having read about it, I would probably just say, well, it's just your normal amount of activation of the muscle. And that's kind of true. But there are a lot of things that go involved. So you have muscle spindles and Golgi tendon organs in the muscle and tendons that give sensory feedback to the nervous system. You've got things going on from the brain and cerebellum and the spinal cord. There's a lot involved with muscle tone, and there's fluid metabolism involved in muscle tone as well. If you've ever worked on somebody with low leg edema, you know how hypertonic the muscles are, and that's not muscle tone. That's fluid. So there's a lot that goes into muscle tone and what we're feeling. But when we say hypertonic, most of the time we're talking about electric activity in the muscle. And there's a baseline that they'll see on an EMG, like electromyography. There's like a baseline of electric signaling. And that is your muscle tone. That's the tonic, like in music. That's the pitch. So tonic muscles and phasic muscles that Dr. Yanda would talk about. Tonic muscles are your postural muscles. Those are the muscles that tend to have the most muscle tone. Muscle tone is thought to be your body's preparation for activity. Your body has this low level activity going on in the muscles that activates them so that when you need them, they're already ready to go. And so our tonic muscles have the most tone, and muscle tone can lead to muscle shortening. If you have a labral tear in your hip, you know how the labrum is like a cup that stabilizes the head of the femur in the joint, the acetabulum. So you have this cartilaginous cup that's stabilizing the joint. And there's a bunch of ligaments too, but this is why the labrum becomes important. When the labrum has a tear and it becomes less stabilizing for the joint, for the head of the femur, the muscles, well, the ligaments too probably are also increasing tone, but the muscles will increase tone to stabilize the hip better. Injury can cause increased muscle tone. Instability can increase muscle tone. Autonomic sympathetic dominance increases muscle tone. I'm going to talk about that in a minute. So you have an increased muscle tone of the hip stabilizing muscles, especially things like the TFL and the glute min. So you'll see those muscles over time become more shortened as well. So not only are they hypertonic because of the muscle tone increase, but they become hypertonic and hard because they're actually physiologically shorter. The muscle cells have shortened due to constant tone increase. When you increase the muscle tone beyond the normal, you are prone to more muscle shortening, or it becomes hypertonic and short. You see that people who suffer from migraines that are driven by the trapezius and other neck muscles, stress can trigger a migraine. The assumption is that under an increased activity of the sympathetic dominant state of the nervous system, stress, that you increase tone on a muscle, it will put more pressure on the nerves, the occipital nerves, because the aponeurosis of the trapezius is where those nerves come out to innervate the scalp, and the tension on the upper trapezius irritates the occipital nerves, drives a migraine. So you increase. I'm sure there are other autonomic reasons for migraines, but this is a physiological one that we can explain. Botox is a go-to for a lot of neurologists who treat migraines because it will decrease the tone on the trapezius. Now, I would make the argument that increased muscle tone on the trapezius has also increased the amount of shortened muscle fibers. So, dry needling of the upper trapezius, especially when there's those active trigger points, can not only deactivate pain chemicals in the trapezius that will help with their migraines, but will decrease the amount of pulling on the back of the head, so that even when the person is under stress and increased muscle tone, it will not be sufficient to irritate the occipital nerves. Same thing with low back pain. If you're familiar with Dr. Sarno, I have not read his book, but if you work in pain long enough, you meet a lot of patients who have, and some people swear by it. They love it. I'm not here or there on it because I haven't read it. It wouldn't be fair for me to give a criticism or a praise. But what I do know about his system is that he's not saying your pain's in your head. What he's saying is the pain is being driven by the things in your head, the stories and memories and anger that you are not processing well are driving your pain. I believe he would probably have agreed that it was due to a sympathetic dominant state where you increase muscle tone. If you can resolve the things that most stress you out, you'll have a decrease in muscle tone in those muscles like the psoas that affect your back and the erectors in the back, and you'll have less pain. The people for whom fascia pecking on the rectus abdominis, abdominal fascia, the people for whom that helped their psoas to relieve their low back pain are people who would have done well under Dr. Sarno's system, in my opinion, because the fascia pecking is having a positive effect on muscle tone driven by the autonomic nervous system. And what do we know about fascia and acupuncture? Acupuncture can stimulate the sensory receptors in fascia that will have a positive effect on the autonomic nervous system, putting you into more of a parasympathetic state. It's why we love traditional acupuncture. If you have had traditional acupuncture and you're a high stress person, you know when you walk out of your acupuncture treatment, you just feel better. You don't feel like you're on drugs. You just feel better. The things that were stressing you out, for some reason, you feel no longer bother you. And that effect can last for me, it would last at least a day or two. And it's just a nice reset for the week. I used to get traditional Chinese acupuncture every week before I ever became an acupuncturist. It's how I got so interested in acupuncture. I wanted to understand, how does this work? I would go in completely stressed out and walk out, and it was as if I'd been lobotomized against all of the things that stressed me out. I could think of them in my mind and not have an attachment of emotional reaction to it. So that influence of the needle on muscle spindles and fascia must be able to regulate the sympathetic dominance driven by the autonomic nervous system that is driving the muscle tone, or the increase in muscle tone, or hypertonicity. So this is how I believe acupuncture can be uh, a good relief for pain, and it's temporary when it's only addressing that. If it's just addressing muscle tone increase that is driving pain, then it's temporary relief. Now, for many people, that is sufficient. If they can afford or they have insurance that will cover them going regularly, that can be a big boost in their quality of life to not have to take as many medications and to have less pain. So, in my opinion, the fascia pecking is beneficial for certain people for whom the psoas is hypertonic due to stress, but not so short that it can't be relaxed enough to get you out of pain. If you've had that hypertonicity long enough, the decrease in muscle tone will not be sufficient because structurally the psoas is still increasing the lumbar lordosis, pulling on the L4-5 and creating a counterbalance tension in the spinal erectors that protectively have to tighten against the short psoas. That's hypertonicity of the spinal erectors. This is a case where I've talked about it before, but if you're if you're treating the QL, someone's face down on your table, you've used the motor points of the QL and the erectors, but they didn't relax enough. That's a hypertonicity being maintained by the nervous system in a counterbalance against a tight, short psoas on the front of the spine that is increasing the lumbar lordosis. Now, releasing the psoas will correct for that. And if you go back and you feel the erectors, you'll feel that the muscle tone has been able to decrease and they now feel supple. So it's a protective thing. If you hurt yourself, if you sprain an ankle, the muscle's tonicity will increase as a protection to the joint. The motor points of the muscles can reset the muscles to a normal level of muscle tone and can correct for muscle shortening that accumulated from either a long-term increase of muscle tone or just overuse in general. So muscle tone is an important factor to consider for treating pain. It's for some people, decreased muscle tone will be sufficient to take pressure off of joints so that they have less pain. The same thing for headaches. Decrease in muscle tone, that means decreasing the sympathetic dominance will have a benefit. So absolutely, stress reduction decreases pain. I don't know if you've ever seen my arms, but I have a sleeve tattoo on the left side, and I have a big tattoo on the right shoulder. And when I first started getting tattooed, I had a hard time sitting for 2 or 3 hours of the ink. Because it becomes just excruciating if you are tense. And what I found was if we used his massage table instead of the chair, he had like a barber's chair, and he would put my arm off to the side and he would needle and he would do the ink that way. But what we discovered was that I could sit much longer for a more comfortable amount of time, for 3 hours with much less discomfort if I could lie down, because I could breathe and actually fully relax my muscles. It makes a big difference. If you decrease that tone on the muscle that's being driven by stress and the sympathetic dominant state, you can decrease pain. So it's not only just functional on the joints, but just that increased tone increases the level of pain that you're going to feel. So that's my opinion about why certain things indirectly can decrease pain. I was in a community clinic doing acupuncture for people, like a new patient every 15 minutes. And if you know community acupuncture, it's typically done with everyone, their clothes are still on. You just have to put needles into hands, feet, legs, arms, maybe ears, but you're not really going to treat the body. So you want to use distal systems that work. Dr. Tan's balance method, master tongue were my favorites. And every once in a while, I might be able to reach a motor point. But I remember one guy who came in with back pain that definitely looked like a psoas issue. I didn't have time to put him in shorts and treat the femoral triangle with electric stim on a needle, etc. Right? So I used the stomach meridian in the leg and sort of a tan balance approach to the psoas. And I probably put 2 needles in, and he felt the pain release. He felt the pain go away, and he felt better when he walked out. Um, I don't have a follow up for you. I don't know how long his pain relief lasted, but it's a nervous system thing. It's we decreased the tone on his psoas enough to give him pain relief. It may have structurally been too short and the pain would come back. But if this was an acute activation of his psoas due to some movement that he made, then it might have stayed better because he was just suffering because of an increased tone on the psoas, not muscle shortening due to long-term increase of muscle tone on a tonic postural muscle. So that's my 2 cents. If you're working with seniors, decreasing muscle tone is usually not sufficient. It's something that you can use for sure to decrease their pain. Absolutely. I'm all about giving people pain relief, even if I know that it's not going to last longer than a day. But my goal is always to structurally correct issues that are causing chronic pain so that the person doesn't need to see me every week for life. The goal is to, in 3 to 5 sessions, get them good enough that we can do once a month for a while. And if they're older and they can afford once a month, I want them to come once a month, as long as they can, because they're dealing with muscles that are that have been overused for a long period of time, and they're ischemic, and they're going to be more prone to increased shortening just due to increased muscle tone just from working so hard. They're weaker muscles and they work harder. So I love it if they can come once a month to keep them out of pain. But the goal is always to get them out of my care so that they don't absolutely need me. So I'm not a fan of just treating the pain. I could be really rich, I think, if I only treated pain temporarily and everybody had to keep coming back. That's awesome. Awesome for the practitioner. But having been the patient in pain, I think I'm a lot more sensitive to what the patient really wants, and they want a solution, and it's quality of life. And so I'm not happy with the idea that they need me every week forever. I really want to hear when I see them that they went hiking with their grandkids, or that they went to their granddaughter's wedding and were able to stand the whole time at the reception, which would normally not be possible. I love things like that. One of my new patients, I saw her for her 3rd visit a day or two ago, and she's so happy that she doesn't have chronic sciatica anymore, and she could stand for hours. She went to a street fair and she walked all over the place, and she was with her friends, and she did all the things that she had wanted to do, and she didn't have her sciatica, and she didn't suffer for it the next day, which would have been her normal, to suffer for it during and after. And she told me, and she said it was amazing. So that's the goal. Like, it's quality of life. She's not gonna run a marathon, but that's not her goal. She just wants to live her life and not have to suffer for it. So I feel like if I'm just treating pain by relaxing the muscle tone, really, decreasing muscle tone via the autonomic nervous system, it's a good start. But if I know I can do better, I'm going to do better. I want to correct the problem. And it's usually muscle shortening. And the muscle shortening is there because of increased muscle tone on the postural muscles, the tonic muscles that are prone to shortening. So that's my 2 cents. I highly recommend that acupuncturists who want to treat pain learn how to release the psoas in the femoral triangle, where it's safe to access it, it's easy to get to, and where you can make enormous changes in the most chronic patients for back pain, sciatica, knee pain, hip pain, hip impingement, neck pain, migraines. There are so many things that get messed up by a psoas that shuts off the glutes and puts an anterior pelvic tilt on the person, causing all sorts of other problems. If the psoas is weak, then the other hip flexors work harder. And when other hip flexors have to work harder, probably you're going to have knee pain, and you may have other low back issues. So sorry if that was a long rant or diatribe, but I just think it's important to sort of defend how I treat, when I know there are a lot of people out there teaching that you don't need to treat the motor point of the psoas and it's secondary, and if you were amazingly brilliant, you'd know how to do it differently, or whatever the rationale, or you should do it this way. I want to defend how I treat, and I want to explain it from a sort of scientific approach, so that hopefully those of you who are considering learning orthopedic acupuncture will understand when somebody gives you a dogmatic answer like never needle the psoas. You'll understand that you don't always have to listen to them. Okay, so have a great week, and I will talk to you soon.